are aseptic techniques.
Are we gonna have to practice this in the EC or main as well? Because I think I'm in emergency.
Yes.
Okay, I figured. Also sidebar, which of those are you?
ISFJ.
Yeah. Woo!
Defender?
All right, settle down, guys. Okay, aseptic techniques. So, what are aseptic techniques?
Sterile techniques.
Sterile techniques. Do we use aseptic techniques every day?
Yes.
Yes, we do. Examples are our hand washing, wearing our masks. That's all a way to prevent the spread of infection, correct? So aseptic techniques are standard protocols and policies that are set in every hospital or healthcare setting in order to prevent infections.
Could vaccination also be considered aseptic technique, or is that too?
I don't think so. I've never heard of that being part of aseptic techniques.
Okay.
So typically, we use aseptic techniques obviously in surgical settings or any procedure that involves the puncturing of the skin. When we insert IVs, we're practicing aseptic techniques. We wear gloves, we wash our hands, we use alcohol to prep the skin before we insert IVs. Any sort of catheters or drains that are dwelling inside the patient's body, all of that uses aseptic techniques. So, what does asepsis mean? Well, it's right there on the screen. A means the absence of, and sepsis means infection. So therefore, asepsis means the absence of infection or the absence of pathogens. There are two types of asepsis. Medical asepsis, which we do almost every day. We wash our hands before we provide patient care. We wear our masks. When we're in the OR, we wear our surgical caps, our gloves, etc. Those are all medical asepsis. Surgical asepsis is sterile technique that's strictly for any surgical procedures. The doctors, they perform surgical scrubs before they enter the OR. All of the equipment that is used in the OR has been sterilized. They use sterile drapes on the patients to prevent germs and other organisms from spreading or preventing infection. And so therefore, the goals of aseptic technique is to protect the patient from infection, and it prevents the spread of pathogens or harmful microorganisms. Any questions? Am I going too fast, by the way?
No.
That's fine.
Oh, sorry, this is from before. Are the exams for this class exams that you've written, or are they just like?
So we have like a test bank on ExamSoft. I might pull some from there, but nothing will be, or everything that you see on the exam will be from the book or the PowerPoints.
Okay.
It'll be stuff that you see. All right, so sources of infection. There are sources of infections everywhere, especially in the healthcare setting. You know, we can't see it with the naked eye, but they exist everywhere. Skin, hair, droplet, fomites. Y'all discussed fomites last semester, correct?
Yes.
So give me an example of one.
Doorknob.
Cell phone, doorknob, TV remote, everything can be a fomite. We can get infection from the air, or through human error, or cross-contamination. You know, believe it or not, there's some nasty people out there, especially in healthcare. They might walk into a room wearing dirty gloves, come out of the room and start typing on the computer. All sorts of ways of cross-contamination. Did I go too fast? All right, so surgical asepsis is the complete elimination of the disease-causing agents and their spores from the surface of an object. That is what the surgical asepsis. Now, certain bacteria, in order to survive, they create what is called spores, which is a very tough exterior in their cells. So it's almost impossible to destroy these certain types of bacteria. And that's where surgical asepsis comes in. When, if you're in OR this week, you will notice that there is a lot of sterile equipment that will be used, and all of that is sterilized in what is called an autoclave. Anyone know what that is?
UV, right?
So it's basically a machine that uses high pressure steam in order to completely destroy all microorganisms. So anytime you see surgical equipment, gloves, etc., all of that has been sterilized. And betadine is an antiseptic solution that every surgical procedure, you'll see the nurses clean the patient's skin using this before they make an insertion with a knife.
That's it's similar to iodine, right?
Yes, it does have iodine.
Oh, okay. So it's like a mix.
Yes.
What happens to patients?
Antiseptic one.
I believe there's other alternatives if they are allergic. So this solution is antiseptic, but is not sterile. Okay, this is just used as a prep for surgery. Before they make that first cut into the skin, they want to kill all of the germs that are on the skin surface.
Ma'am,
Yes.
what do you mean by antiseptic but not sterile?
So an antiseptic solution is something that kills germs, but the solution itself is not sterile. Right? It's not been put in an autoclave and sterilized. Does that make sense?
So it won't,
But if it's not sterile, it kills whatever.
It kills the
germs,
germs.
it kills like the
So-
bacteria.
I've been at
In some bottle, is it?
Say that
Yeah.
again?
It kills the, I just said it kills the germs.
Yes, so the antiseptic solution is used as a way to clean the skin and prep the skin before surgery, right? It kills the germs that are on the surface. Now, is it going inside the skin? No, it's
No.
not. That's why it doesn't need to be sterile.
Oh, okay.
But the container itself isn't also like sterile per se,
Correct,
right?
yes.
Okay.
The only thing that is sterile will be equipment, all the surgical tools, etc., that actually make contact inside the patient's body, okay? Alright, moving on. And medical asepsis, we do this every day, it's just the reduction of the number of disease-causing agents and their spread. We wash our hands with soap and water, or we use the sanitizers on the wall. That is all examples of medical asepsis. So that is just a reduction in the number of disease-causing agents. It's not completely eliminating it.
So that's the difference between surgical and medical.
Correct. So in the OR setting, you will notice that every single person has a hair cap, a mask, gloves, etc., gowns. That is all medical asepsis. That's a way to prevent infection from spreading. They are also using surgical asepsis with the use of sterile equipment. So they use both.
Excuse me, ma'am.
Yes.
Surgical, blue color is only for, in America for surgical asepsis, or is it international, ma'am?
The color blue?
For being sterile?
Some hospitals might have green, but
Yeah.
here I've primarily only seen blue. So yes, anything that is blue, do not touch. That'll be a no-no.
And it is sterile,
It's sterile, yes.
sterile,
Mhm.
sterile.
Yes.
So for IR, do you also have to be in scrubs?
If you are
Can you go back?
the radiologist or the person performing the procedure, they will have all the full gear, the gown, the sterile gloves, etc. I think the techs usually just set everything up. I've never seen the techs actually gown up unless the radiologist requires you to. opening the sterile tray will be a proficiency that you can get in IR. Got it?
Thank you.
Alright, so this is a little fancy chart for you to easily remember the differences. Medical asepsis can also be referred to as clean technique. Just washing your hands with soap and water or wearing gloves. You will see nurses or other people whenever they administer medications to patients or anything that has to do with feeding them or just daily hygiene. Hand washing is obviously number one, and then you'll see them wearing gloves. And then surgical asepsis is the complete elimination of all pathogens, and we refer to it as the sterile technique. And it's used in surgery, any sort of catheter insertions, and dressing changes. Alright, so in the OR, you're going to see numerous people. There's gonna be the attending surgeons, there's gonna be at least 3 or 4 residents in there. There's gonna be the CRNA or the anesthesiologist, or nurses, sometimes 2. Then there's you, there's the rep that's going to be there explaining what to do with the equipment, maybe 8 or 9 people in OR. So it's a very highly stressful environment. So our role as a radiologic technologist is to maintain the sterile field and know how and when to move, where to move the C-arm. If you are moving the C-arm and you hit somebody on the head, or if you hit somebody, or if you hit the light bulbs on the ceiling, they're going to look at you like, do you know what you're doing?
So would they have to change that covering out?
Yes, anytime the C-arm or anything touches the sterile field, everything has to be changed. So you do not want to be the person to be the cause of that.
But when you say CRS, what do you mean?
I'll show you just a second. So what is a sterile field? Anything that is blue or green in a surgical setting, this is all sterile. All of this is sterile. You can see the C-arm is draped here that's also the sterile covering of the C-arm, that's also sterile. And the sterile corridor is the area between the patient drape and the instrument table. So this person's job is to hand the surgical instruments to the doctor. They're called scrub techs. Yes. Or scrub techs or surgical technologists, yep. And you'll notice that their hands are always going to be waist level or above, because anything that's below the waist is considered non-sterile in the OR. So they always try to keep their arms above waist level.
Is that because you bump into things?
Bump into things you don't know what's in this area. We can control everything that's up here,
Right.
right? So how is a sterile field established? Whenever a sterile drape is set on a patient or on a table, that is going to be your sterile field. The first step in using a sterile drape is confirming that the package is sterile. You know, packages usually have labels with dates and what's in them. Make sure that everything is not expired, that everything is dry and clean, and you can consider it sterile. If it's not clean and dry, it is considered unsterile. Alright, so sterile package. Like I mentioned earlier, you will have the chance to do this either in IR or fluoroscopy, where you'll just get things ready for the radiologist. And the steps are pretty simple. There is a top flap. That flap is always going to go away from you, okay? So you just grab it, pull it away from you. Do not touch anything on the inside because that is considered sterile. You can touch the outside. And step number 2 is going to be the left flap. grab. By the way, you don't need to be in sterile gloves to do this, because this is just setting up for the radiologist. Grab the left flap from the outside. Pull it off to the side. Sometimes this happens. And third step is grab the right flap. And the last step towards you. Now your sterile tray is ready. No, you're not allowed to touch this without sterile gloves. Okay? Going to pass this around.
Is everything done?
Yes. So use your index finger and your thumb. Okay?
And where
You're
does the
pinching,
ones that
right?
have to do with setup? I thought it was just script tech.
So this is
The
just,
script tech.
not an OR, this is just IR and fluoro. Where you're the tech that gets things ready for the radiologist. So you're gonna set up the sterile tray, get everything
One more
ready.
time?
Interventional radiography.
No, you did it wrong.
Interventional radiography.
Doesn't matter, just do you really have to do it in that order?
So the first
Interventional.
one is going to be the top away from you. I don't really care if it's the left or the right first, as long as you don't touch the inside.
Unless I can do whatever way I want.
But you did the last step second.
So yes, pull that away from you, make sure, yes. Not this one,
So, yeah, I gotta do that one.
the left one.
You got it.
And make sure you're kind of standing a little far from the sterile tray. There you go. What'd you say?
It smells.
Oh, I can't smell it. So y'all can, pass that around in practice. And I have a little video.
How to put on gloves.
No, with this.
Well, I think sometimes they mess with that thingy.
Like a speaker or something.
Oh, the Bluetooth thing?
Yeah, so she can cut the volume up.
Is there supposed to be volume?
Not fair.
Mm-hmm.
I
Maybe they
mean-
got some music playing. Like, you know how they
She's
spin it
awkwardly
up?
doing it in silence.
Yeah.
You know that there's somebody talking, right? Sometimes it's up in a good distance. From the computer. Check, yeah.
That would 5 feet.
Yeah.
That's weird.
Try clicking. Wait, go back to the sound.
Right here?
Yeah. Try clicking the arrow. You see the arrow and stuff?
There you go.
There you go. Nope.
Still.
Oh no, it says bottom left. Look, look. No volume.
Oh.
Yeah, it was. It's a muted video. No,
Oh, okay.
it's a muted video. Yeah.
That's weird.
Maybe it's
It had the speaker sound with the.
oh,
line.
maybe it's for deaf people.
True.
So she's opening a sterile tray.
Is a tray just like, is just there, are there instruments in it, or like equipment, or is it just like it's just a tray?
It's a sterile tray, the stuff that's actually inside it depends on what procedure you're about to do. For example, if you're in fluoro and you're about to do like a lumbar puncture, it's going to be, little tubes to collect the fluids, stuff like that.
And the plastic wrap stuff, if applicable, is gonna be perforated, or we're just gonna have to, like, rip it.
I don't think it's perforated.
Mm.
So make sure you're never reaching over the sterile field once that top flap is open away from you.
Because you might drop like something in there,
Yes,
debris or
and
whatever.
your clothes and everything has
Just sneeze and-
germs.
Oh, if you sneeze, GG.
Okay.
For fluoroscopy, is it normally a procedure where, like, they're incubated, or not incubated, I guess, like, put to sleep? I don't know how to describe that.
I'm sorry, what was the question?
When you do fluoroscopy, are they normally, like, I guess, like, put under, or are they awake during the, yeah, anesthesia?
I think they have
Come
different
out to
types
get
of
the puncture
exams.
for the,
I just mean in general,
Oh.
like, is it just
Or
like,
do they-
is it general?
There's different types of.
Like
Say that one more time,
For
I'm sorry.
for fluoroscopy, are they generally under anesthesia for
Oh,
the procedures, or
rarely.
is it just
Rarely.
rarely? Okay, so they're mostly awake. most
Yeah.
of the time. Okay.
cause sometimes they use that freezing spray, right, when it's
Is
in
it
the,
cold in here?
is that for the fluoro? Like if you're doing lumbar?
Oh, like the pain med?
Yeah, is it like,
Yeah, they use that for lumbar puncture, yes. But it's actually injected, not sprayed. So, when you're in fluoro or IR, there will be some moments where you may have to provide something to the radiologist. It could be like a syringe or whatever the case may be. So, are you just going to hand it to his hand? No, 'cause he or she's gonna be wearing sterile gloves. So you have to drop whatever they require onto the sterile tray. So your job is going to be open the package and drop it onto the sterile tray. Make sure it's about 6 inches above the field. Not too close, not too high up, because you don't want the thing just drop on the floor, correct? So that's one way you also practice medical asepsis, making sure you don't touch what's inside and that the doctor doesn't grab it using his sterile gloves. This primarily is done by nurses in the OR. Sometimes you'll see them pouring solutions into the bowls for the scrub tech to use. And you'll always see that they call out what's on the bottle, what exactly it is, the expiration date, and probably also the amount that they're pouring. So, this is primarily applying to nurses, not rad techs. I don't think we've ever done, pouring solutions into anything.
Is that what they put the word?
I'm sorry?
Doing organ transplant? Is that the liquid that they put?
I've never seen one of those. So, doctors, before they come into the surgical suites, what do they do?
wash their hands?
Wash their hands. And it's not just like, oh, let me just wash my hands for 20 seconds and I'm done. They do specifically what's called surgical scrubbing. You have to remove all your jewelry, including your watches, your rings, bracelets, whatever, and they have antiseptic soap outside each OR suites. And they wash their hands all the way past the elbow, 3 inches above the elbow. And they also use a little scrub to clean under their fingernails. They clean each of their fingers, and they scrub the sides of each finger all the way up to their arm for about 3 minutes each. And you notice that her arms are always going to stay above the level of her elbow. And you'll notice that after they wash their arms, they're going to walk into the OR like this.
But
Yes.
when you rinse your hands, I was told to like keep it down so that nothing from up comes like okay.
Yeah. So the purpose of surgical scrubbing is that your hands are always going to stay clean. That's why they want you to keep it at this height.
Okay.
They walk into the OR with their hands like this, and the scrub tech hands them a sterile towel to dry their hands, and then they provide the gown, the gloves, everything, and they're always gonna keep their hands at their, not below the waist.
How do this is kind of off, but how do scrub techs get sterile then? Like who's sterilizes this stuff?
So they walk into the OR room, have their hands washed. They open the sterile tray that has their gown and gloves. They put on the gown first and the gloves, and after that, they're not allowed to leave the OR.
Oh, okay.
'Cause they're sterile. They're the ones that help everybody else get dressed for OR.
I see.
Okay, we just went over this. Alright, so just like I said, the scrub tech is going to put on their gown once they're in the OR. They're going to grab it from the inside, put on both sleeves, and then somebody is going to tie their tie at the back. And then, of course, everything from the waist up is considered sterile, therefore their hands are not allowed to go past their waist. Sterile gloving, alright. So, I think once I let you guys watch the video, I'll go over the steps.
Anything here to touch them.
You have to put it back on though.
This is simply yellow.
That's good. You have to put it back on the sleep stand.
Oh.
Sterile items to that field, and also how to
This video
sterile
will
glove.
demonstrate how to properly don and doff sterile gloves. Before you begin, ensure you have properly sized sterile gloves. Many procedural kits will include a pair of one-size-fits-all sterile gloves, but most practitioners prefer to use the sized gloves that are available in all the pod rooms at St. Mary Mercy Hospital. Properly sized gloves are easier to don and provide better dexterity during the procedure. So find the size that works best for you. Prior to donning your gloves, remove all jewelry from your hands and wrists. Jewelry can make donning gloves more difficult, but more importantly, jewelry puts the integrity of the glove at risk. It can put unnecessary pressure on the gloves and potentially cause them to tear, which would break the sterility of your procedure, putting the patient at risk for infection, and also putting you at risk for coming into contact with body fluids and infectious agents from your patient. With your watches and rings removed, wash your hands. These gloves are sterilely packaged, and this means that the contents of this outer wrap are completely sterile. But your hands are not sterile, and neither is your workspace. And as soon as anything from within this package touches your hands or any surface, there will be contamination. The goal of donning sterile gloves is to maintain the sterility of the gloves themselves. Parts of the package will need to be contaminated in order to don the gloves, but there is a very specific and deliberate process to follow to ensure that only the necessary areas and items become contaminated during any sterile procedure. Now, open the outer wrap. Remove the sterile package and unfold the first 2 folds of the package, but do not open beyond this point. For now, the gloves remain protected within the package. The outside of the package is no longer sterile as it has been touched by your hands and has touched the work surface. You can do your best to straighten out the remaining folds, but make sure that you are only touching the outer surface of the wrapping. You are now going to open and expose the gloves, but when you do, you have to be careful not to touch the inside of the package, which is still sterile. On the ends of the right and left folds, there is a 1-inch lip folded back on itself. You will grasp this lip and open to the sides. You have now exposed your sterile gloves. They are laid out on what you will now consider your sterile field. The sterile field is an area of your workspace that has not been contaminated. You must be careful never to touch your sterile field with your non-sterile hands, and to never place any non-sterile objects on the field, or the field will become contaminated. You may have noticed that where the sterile field is indicated doesn't cover the entire inner wrapping of the glove package. That is because the outer 1-inch border of the wrap is considered contaminated. No sterile supplies should come within 1 inch of the edge of your sterile field, and if they do, they will be considered contaminated and you will need to restart with new supplies. Take a look at the way the gloves are packaged. You'll notice the cuff is folded back up over the palm of the glove. This means that what you can see of the cuff at this point will be on the inside of the glove when you put it on. You haven't touched the gloves yet, so they are still completely sterile, but you will need to touch them in order to put them on. When you touch the gloves with your hands, that surface of the glove will become contaminated. Think of the gloves as having 2 surfaces, the inner surface and the outer surface. This means that you can never touch the outside of the glove or the outer surface of the glove with your non-sterile hands. But what you can touch is what will be the inside surface of the gloves. The inside of the glove will be in constant contact with your skin, so it is the only surface that you will ever purposefully contaminate. Proper opening of the package was shown earlier, but this first step is commonly done wrong and leads to the contamination of your gloves and a risk for infection for the patient. Make sure to only grasp the inch of the package that is folded back on itself. Never grasp the fold itself. Your thumbs will touch the inside of the package and the gloves as you open the package, and your supplies will be contaminated. If this happens, you will need to restart with new sterile gloves. Also, never touch your sterile field. If you do, you will be contaminating that surface, and you will need to restart with new sterile gloves. When donning the gloves, start by donning the glove onto your dominant hand. So with your non-dominant hand, grasp the inner surface of the cuff of your dominant hand's glove. The inner surface of this glove is now contaminated, but that's okay, because we know the only thing that needs to remain sterile is the outer surface of both gloves. Slide your dominant hand into the glove. You can pull the glove over your hand, but make sure your non-dominant hand is only grasping the inner surface of the cuff. Slide the glove over your hand, but do not pull the cuff over your wrist at this point. Leave it folded inside out for now. Common mistakes include grasping the glove at the top of the cuff. Doing this will bring your hand in contact with the outer surface of the glove and contaminate the glove.
Now there's treatment for COVID-19. Q-Care brings it right.
Always remember, you can only touch the inside surface of the sterile gloves with your non-sterile hands. With your dominant hand properly gloved, you now have a sterile hand. That sterile hand can touch any part of your sterile field or any part of your remaining glove, and nothing will become contaminated. But if you touch anything outside of your sterile field with that hand, the dominant hand will become contaminated, and you'll need to restart with new sterile gloves. You're going to be inserting your non-dominant hand into the remaining glove, and while doing that, you must ensure that the now sterilely gloved hand does not come into contact with your remaining non-sterile hand. So you will hold the non-dominant glove differently. Work your dominant hand under the cuff, touching the outer surface of the remaining glove. Because your hand is now sterile, it can touch the outer surface of the remaining glove without contaminating it. Work your fingers under the cuff and up to the fold of the cuff. Then slide your non-dominant hand into the glove, being careful never to touch your dominant hand or the outer surface of the non-dominant glove. As you get your hand completely into this glove, you can unfold the cuff down the wrist. Be careful your dominant hand is still only touching the outer surface of this glove and never comes in contact with your skin. Mistakes are made during this step as well. First, make sure your gloves never touch anything outside the sterile field. And remember that when you have one hand that is sterile, the second glove is not donned the same as the first. Don't grasp the inner surface of this cuff. That will lead to your non-sterile hand contacting your sterile glove and contaminating it as you pull the glove on. With both gloves donned, both hands are now considered sterile. You need to extend the cuff of the dominant hand over your wrist. So with your sterile non-dominant hand, slide your fingers under the cuff so that they only contact the outer surface of the glove. And then carefully unfold it down the wrist, ensuring you never touch the inner surface of the glove or your skin. Common mistakes seen while unrolling the cuffs mainly involve grasping the cuff and pulling it down instead of rolling it. This will lead to your sterile glove coming into contact with your skin and contaminating the glove. Also, never pull the glove down over your arm and allow it to snap back to your wrist. This leads to a lot of uncontrolled and unnecessary movement of the sterile glove and will likely be contaminated by your skin in this process. Finally, if at any point your sterile gloves come in contact with anything non-sterile or touch the surface outside of the sterile field, they are contaminated. Do not continue to don them. Dispose of them and get a new sterile glove package. Most practitioners will bring an extra pair of sterile gloves into a procedure just in case sterility is ever broken. This way they can don new gloves and continue with the procedure. You have now donned both sterile gloves, and your hands are both considered sterile at this point. You can continue to your procedure. Removing or doffing sterile gloves is not difficult, but again, they're...
Alright, I know that was a lot of steps. You don't need to worry about remembering that just yet, because we'll practice putting on gloves on Friday. But these are just the steps, just to summarize. So you always want to start with your dominant hand. Grab the glove with your non-dominant hand by the inside cuff with your left hand. For me, it's my right hand. Do you have a question, Cody?
No, I was just mimicking your hands.
And so with your left hand, you're going to grab the glove from the inside cuff, and then you have to make sure not to touch the outside surface of the glove, because that's going to be sterile throughout the procedure, correct? It's gonna make sense when you actually see the glove on Friday, but using your non-dominant hand, you're going to grab it by the inside cuff and then place it over your right hand leaving the cuff right there, don't pull it down yet. And now with your gloved hand, which is considered sterile, you're going to pick up the left glove by reaching under the cuff, because that's sterile. You're not going to reach inside, because that's going to be considered non-sterile. So you're going to grab that glove and, touching only the outside surface, pull it onto your left hand, and then once you have both gloves on, you can roll the sleeves down. And like the video said, don't pull it all the way to your forearm, so that way it doesn't snap back. And I think that's a good place to stop for today. You guys have any questions?